Yes, doctor.
Okay, so today we are going to see about Kent's 12 observations. So, in the Kent's lectures under the chapter Prognosis after observing the action of the remedy, he states about the 12 observations which are very uh, seriously to be taken for all the practicing physicians. So, first of all, he gives a note on importance of observations. So, he states that if the homeopathic physician is not an accurate observer, his observations will definitely become indefinite. So what happens is that he's prescribing to become indefinite. So who will be in the loser side? Ourselves as well as the patients will be in the loser side. So he tells us what is the importance of observations through these single statements. So he tells that after you have given a remedy, there are the effects of the remedy that has to be known, and there are two types of effects you can expect from a patient after you have given the remedy. That is an aggravation and an amelioration. Again, this aggravation is divided into two types, which is aggravation of disease and aggravation of the symptoms. So what we tell as our homeopathic aggravation after we have given the medicine to the patient has taken it, and patient shows an aggravation of the symptoms, it is the homeopathic aggravation. So he tells us how to differentiate between a disease aggravation and a symptom aggravation. So in an aggravation of the disease, what happens is that the patient will be worse, growing weaker, the symptoms will be growing much more stronger. And in the case of a homeopathic aggravation, due to the similar action of a remedy, the aggravation of symptoms will be present in the patient, but at the same time, the patient will be growing better. So, even though the patient is having an aggravation of symptoms, in the case of homeopathic aggravation, there will be the mind and as well as the general states of the patient will be growing better. So he tells that the aggravations and ameliorations, the direction of symptoms, and many other things have to come up and be observed, and judgment has to be passed upon them. So just coming to the 12 observations. Before that, he is just giving us an introduction as regards what it is an aggravation, what it is an amelioration, and what are the types of observations, and how we are able to identify such aggravations in a patient. So we know that it is 12 observations. So starting from the first observation, these observations are very important in the clinical aspect as well as for examination purposes. As you all know that 2016, if you look at the question papers, so many of the questions have been asked from this area. From all the observations, how when they have applied it to a clinical case, they have asked questions like that. Which observations will be coming to this? Which you can correlate like that. So prolonged aggravation and final decline of the patient is the first observation. And what it's saying that the antipsoric medicine which we gave to the patient was too deep, vital reaction was impossible, and it was an incurable case. So, what we should do that at that time, if there is an incurable or a doubtful case, we should not go higher than the 30 or the 200 potency, and we should observe whether this aggravation it is deep or prolonged. And he tells us to begin with a moderately low potency, and the 30th is low enough for anybody or anything. So, this is the first observation stating that there will be prolonged aggravation, and finally, the decline of the patient happens. Incurable case it may be, reaction was not possible, and the antipsoric also was too deep. So in such cases, if you want to go, you can start with the 30th potency. So next is the long aggravation, but last, final, and slow improvement. So here he comes to tell that the disease has not progressed quite so far as we have seen in the first observation. So the prognosis of this case, how it will be? In doubtful cases, we go to the lower potency, and we should be prepared to antidote the medicine if it takes the wrong course. So even though there will be aggravation, at last there will be a slow improvement. Now, coming to the third observation, the aggravation is quick, short, strong, with rapid improvement of the patient. So, this is a good observation, having a good prognosis. Usually, the third and fourth one they are related to the cure. That is what the observation is related to cure. You can tell us the third and the fourth one. So, what is the prognosis? Is that the improvement will be marked and long. The reaction of the economy is vigorous. There is no tendency to structural changes, and any structural change, if present, will be found on the surfaces of the body. That is, the structural changes are not vital, and abscesses in the regions that are not important to the life of the patient. That is an example of what the structural change we can find on the surface of the organs. And an aggravation quick, short, and strong. It is followed by quick improvement. So, where can we see such an aggravation? In a case of acute sickness, after you have given the medicine, this aggravation occurs in the first few hours, and in chronic days, you can see such an aggravation in the first few days. So, the aggravation which is quick, short, strong, with rapid improvement of the patient. That is what we are telling about the homeopathic aggravation. This is a good prognostic factor telling that the case is a curable one. And if we are giving the right remedy, we can expect an acute aggravation in the first hours in the acute case. And in a chronic case, we can find it in the first few days. So, next one is the administration of the remedy. It is followed by no aggravation whatever. So next, he is telling that the administration of the remedy, it will be very minimum one, and you won't have any aggravation, whatever it is. So here, there is very satisfactory cures. There was no organic disease, no structural changes, and the chronic condition, it just belongs to the functional level, and there is no involvement in the tissue level. Cure will come without any aggravation, and the potency it just exactly fitted to the case. The patient returns to the health in an orderly way, and this is the highest order of cure what we can expect in an acute affections. And this is no aggravation with recovery of the patient. In the third observation, we got a little bit of aggravation of the symptoms with recovery. Here, we don't have such an aggravation, and it is to the direct recovery of the patient. Next comes the fifth observation. The amelioration comes first, and the aggravation comes after. So, what the prognosis in this case is that if the condition is an unfavorable one, the remedy, it was only a superficial remedy and it just acted like a palliative, or the patient was incurable. And the what happened with the remedy is that the remedy was either an error or it was only similar to the most grievous symptoms, and it did not cover the whole case. It even did not affect the constitutional state of the patient, and so the selection of the remedy was an unfavorable one. So the amelioration comes first and aggravation comes after. The fifth observation, it gives an unfavorable condition because of the superficial palliative effect of the remedy. The next observation is that you have a relief of symptoms, but it is too short relief of the symptoms. And the amelioration time, it is usually too short duration. So why it happens? That is what Kent is trying to relate. You have an aggravation immediately after, and then you have a quick rebound. And the amelioration, it is too short an amelioration of the remedy. And why it happens so? There is some condition which is interfering with the action of the remedy, and that action, it may be unconscious or intentional from the side of the patient. That is what he is trying to relate. And here he tells that it is a quick rebound of the well selected remedy. The vital economy was in a, if it is in a good state, the recovery will take place. And in acute cases, you can see sometimes too short amelioration of symptoms. For example, he gives a dose of the medicine which is given in a most violent inflammation of the brain may remove all the symptoms for an hour, and the remedy have to be repeated again. And at the end of the repetition, we find that there is only a amelioration of 30 minutes. So in case what is happening is that only too short relief of the symptoms is happening because there is something interfering with the action of the remedy, because the remedy is able to act only for a few time, and after that something is obstructing it from the part either of the patient unconscious or intentional. So next, it is not a good prognostic observation. Seventh observation, it is telling about the pathological conditions. So in an observation where it is too much related with the pathology, showing no scope and only palliation can be done, that is the seventh observation, telling that it is a full-time amelioration of the symptoms. But even though all the symptoms of the patients are ameliorated, there is no special relief to the patient. So, what does it implicate? That there is a latent existing organic conditions. The patient is only curable to a certain extent. After that, it is not curable. We can just only palliate that condition. The remedy will act favorably, but patient is not cured and he can never be cured. That is what Ken says. So he told that the patient is palliated. So this is the observation regarding palliation as well as for the pathological conditions arising in a patient. The Kent observation that is relating is the seventh observation, full-time amelioration of the symptoms, yet there is no special relief of the patient. So he is telling that a patient with one kidney can only improve to a certain degree. Patient with fibrinous structural changes in certain places, tubercles that have become encysted, and lungs capable of doing only limited work will have symptoms. And what can we do when they all have such symptoms? This can be ameliorated from time to time with some of the remedies. But how can we cure such a patient? We cannot cure it. Only to a certain extent, we are able to give relief to the patient, and that is known as palliation. So, all these conditions with latent organic conditions, it cannot be cured by us, and it can only be palliated with the help of our remedies. So, next, it is coming about something related with provings. Certain patients, they some patients prove every remedy they get. Which all drug you give, they all prove it. Why? Because they are too much sensitive to such drugs. They are the oversensitive patients. They are also incurable. Idiosyncrasy, they have a type of idiosyncrasy to everything. Hysterical, overout, oversensitive to all the things. So Ken says that administer a dose of a high potency, prove prove that the medicine the remedy the prove that medicine the remedy has its prodromal period, its period of progress, and a period of decline. So whenever you administer a dose of high potency to such a patient who is an oversensitive patient who prove every remedy they get, what they will do is that they shows that remedy is prodromal period, period of progress, and a period of decline. Just one second, sorry. So, how to cure their acute diseases? We can cure their acute diseases by giving them the 30th and the 200. And in chronic disease, Dr. Ken says that we can give them the 30th, 200, and the 500 potencies. But now we are not used to this 500 potency. Maybe at the time of the Ken, it was there. But we just go for 30, 200, 1M, 10M like that. And oversensitive patients are very useful to the homeopathic physician in provings. Why? Because they bring out the beautiful symptoms in a proving. Since they are very sensitive, they can bring each and every type of proving symptoms because it goes to the inner core of the patient. So that remedy can be well proven in such patient, that is to the oversensitive patients. So this is the observation relating to proving. So they prove every remedy they get. That is the eighth observation. And now it comes to the action of the medicine upon the provers. So here they tell that there are healthy provers who get benefited by the provings, and how we have to procure the symptoms is that we have to write the constitutional states of the individual at first, and then with the proving symptoms we have to compare it and to take all the proving symptoms apart from their constitutional states. And that is how he tells that write down the constitutional states of an individual and subtract them from the proving in order to get the pure symptoms. So this is related to proving of medicines. Now the 10th observation, where new symptoms appearing after the remedy. So, whenever you're giving a remedy and some new symptoms are appearing after the remedy, so what does that state? That states that the prescription was not a favorable one. Why? Because apart from the patient symptom, you're getting new symptoms. And what does that new symptoms indicates? That maybe the remedy is acting on some spheres other than what it is expected to act at. So, the prescription was an unfavorable one. Maybe an old symptom coming up that the patient has not observed and thinks it is a new one. So that can also happen. But if for one new symptom, we can think like that. Maybe it is an old symptom of the patient itself that is coming up. But what to do for an array of new symptoms on 5 to 10 or 15, 20 new symptoms after the administration of remedy? So that means that we have to be doubtful on our prescription, and we have to find out whether this prescription has caused such symptoms in the patient. So the new symptoms appearing after the remedy, it does not have a good prognosis. It shows that the prescription is an unfavorable one. Next is the 11th observation, where Kent is saying that the old symptoms are appearing. So what does it tell when an old symptoms is reappearing? It means that the disease is curable. They have only disappeared because the newer ones have come up. Old symptoms to appear after the aggravation has come. The symptoms are disappearing in the reverse order of their coming. The patient is on the road to the recovery, and usually the diseases get well from above downwards. So medicine must be let alone. And what happens if the old symptoms are staying back like that? Then you can give a repetition of the dose, the same medicine in the same dose. That is often necessary to cure that. So old symptoms reappearing, it is very good prognosis, stating that the disease is curable, and they have come up because the symptoms may be disappearing in the reverse order. That is why the latest symptoms are going and the old symptoms, they are coming out to the picture. So we can tell that the patient is to the road of recovery. So this 11th observation, has got good prognostic value. And next is the 12th observation, the last and final one, which tells that the symptoms take the wrong direction. So what does that mean, that the symptoms take the wrong direction? It means that the remedy, it was not good and it should be antidoted at once. Why? Because otherwise some structural changes will take place in the new site. And why it does happen? Because we have already studied the Herring's law of cure. From center to circumference, usually the symptoms are appearing. Life is also like that, from center to circumference. So when the disease also goes, it is from the center to circumference. It should be like that, going out from the centers of the life, out from the heart, lungs, brain, and spine, out from the interiors upon the extremities. When that is happening, it is good. Instead, something from the circumference, it has been driven into the system. What will happen? They will cause structural changes. So Kent has told that when the symptoms are taking a wrong direction, the remedy must be antidoted at once. Otherwise, the structural changes will definitely take place in a new site. So these were regarding the 12 observations, Kent observations. And I have just put 2 to 3 previous questions which has been asked. And among that was one of the question stating that which of the following Kent's observation, sorry, which of the following Kent's observation demands palliative remedy? So that was asked in 2015. Um, and MD exam. And what it states is that it is about the seventh observation, where there is more pathological changes and palliation can only be done. As I was stating that also, I was telling you that this is observation having too much of what pathological prescription means, pathological changes in the patient, which in that observation, when it comes, we cannot cure that condition, and certain palliative remedies has to be given. So next is 2014 question paper. We see that Kent's 11th observation conceptualizes what? As we all know, that is the old symptoms are reappearing. What does that mean? It is happening according to the Herring's law of cure. So the answer will be Herring's law of cure. So Kent's 11th observation conceptualizes Herring's law of cure. And next question is that wrong selection of homeopathic medicine is illustrated in which Kent's observation? That we all know. Symptoms taking the wrong direction and all, that is related to the 10th observation. So there is also one more question. Like it has come in 2016 question paper, and as I have mentioned earlier, please go through the MD exam 2016 question paper, where you can see too much of questions has been asked from that Kent's observation. So it can be asked in any forms like that you see, maybe direct form or as an applied level. After administration of an appropriate homeopathic remedy in a case of acute viral conjunctivitis, which of the Ken's observation is most likely to be observed? So this is stating that you're giving an appropriate remedy in a case of viral conjunctivitis and which Ken's observation is most likely to be observed. As you're giving an appropriate homeopathic remedy, what will happen? Usually, there will be a slight intensification of symptoms, which is known by the name of homeopathic aggravation, and it will eventually lead to the curation of the condition. So that will be amounting to the third observation. And if you're giving the particular simillimum, you can expect no aggravation at all. If there is no aggravation, it will be the fourth observation. Then there is another question. A patient developed quick short aggravation followed by rapid improvement after administration of the remedy. So, what will be your next plan of treatment? So, there is a quick short aggravation and there is a rapid improvement. And what we should do at that time, you should not give any medicine at that time. So, that was regarding the Ken's 12 observations. Next, we pass on to Ken's symbol substance. So, why I am relating this with means simple substance is that we know that vital force it has got various names by different authors, and as per Kent, it is simple substance. So he gives that the simple substance has got many types of what qualities. So he tells about each qualities that simple substance is endowed with formative intelligence, so it intelligently operates and forms the economy of the whole animal, vegetable, and mineral kingdoms. It gives to everything its own type of life, gives its distinction, its identity, and it differs from all other things. And it is a continuous one from beginning to its end. And there is continuous influx of this simple substance into the man from his cause. So even from a cause also, there is an influx into the body which causes a disease. And as well as in the case of a simple substance itself, it's working inside according to its own type and it is a continuous one from the beginning. And it is the one that is intelligently operating from within us. And next is it is subjected to changes. So what it is meant by subjected to changes is that mm, we have a flow of energy and that may be in order or disorder. When it is in order, we have a healthy condition. And when it is disordered, we have a sick appearance or sick symptoms that is appearing to the body. So, Ken says that man may cause it to flow in disorder. So, man is the one who is having what ill thoughts inside him, and he causes the flow of it to be disturbed and in disorder. And next is it perverts the entire material substance without disturbing or replacing it. So whenever a person is being occupied with a simple substance, it doesn't displace anything. Like magnetism can occupy a substance and doesn't not displace anything, nor cause a derangement of it. So it is not the purpose of person to disturb or displace the subject which it occupies. So simple substance is capable of occupying the material substance without accident to the substance itself. So nothing will be changed when a body has been occupied by a simple substance. It just remains inside without displacing or disordering. So that is the third quality of a simple substance. And next is that it dominates and controls the body which it occupies. So there is a cause of force, and the body does not move, think, or act unless it has its interior degree of material substance. It keep all the things in order. Function and perception, everything are kept in order. Universe itself is kept in order. It not only operates every material substance, but it is the cause of cooperation of all the things. So it is the one that is controlling the body, and it is the one that is keeping everything in order. When it is not in when it is not in its own peculiar form, everything will be caused to disorder. And it is matter is subjected to reduction. It can be continuously reduced until it forms a simple substance, and it is not subjected to restitution. So here what it is meaning is that you have a, coal, like a charcoal, you think, animal charcoal or something, and vegetable or animal charcoal, and you prepare a remedy like carbo veg from it. So it is subjected to reduction. That is, from that thing, coal, you have taken the remedy, what carbo veg. By too much of process of dilution, potentization, reduction, everything has happened. That material as such is reduced to form of a carbo veg, and you have using it as a medicine. So the matter, it is subjected to reduction, and it is not subjected to restitution. What does that mean? Once you have taken a prepared a medicine of carbo veg from that coal, you are now able to give back the coal as such from this carbo veg. That is what they meant by restitution. You cannot bring it to its ultimate form once it has been reduced. So, no substance can be returned to its ultimate form after it has been reduced to its primitive form. So, it is not in the power of man to change from the first to the last. It is not his power to ultimate the simple substance. So, this simple substance, it cannot be changed to another form, or it cannot be given, means from the first to last, it cannot, we cannot change its power. That is what he's trying to tell. And next is, it exists as a simple compound or a complex. So the simple substance, which is the vital force itself, it never disturbs the harmony but always continue from the first to the last, and in that way all purposes are conserved. When the simple substance come together, it is not disturbed or destroyed, and each retains its own identity. The composite substance and simple substance is brought together and they have a complex form. This dynamic simple substance is dominated by another higher simple substance for the higher purposes of our existence. And they never disturb each other, harmony. They all continue from the first to last, and they are all conserved in the same purpose. And next is, quantity cannot be predicted of simple substance, but quality in degree of fineness. You can see like the action of sulfur 55 like what it is given in Kent, in infrequent dose is not working any longer, then you can give the CM potency and curative action will take place. So the quantity is not to be looked at. You have to look at the quality, and that quality have been shown through the degree of fineness. When you're giving a 50 it is not working, then you can go for a 100 And when you raise the potency to a 100 what is happening? It is becoming two more finer, right? You're doing that much of potentization, that much of dilution. And after that, what happening is that you can see that sometimes the curative action takes place. So it is not the amount of material quantity that you have to see. It is all about the quality. And that quality, it is upon the degree of fineness, depending upon the degree of fineness. So that is another quality. And next is the quality of adaptation. Simple substance adapts itself with the environment. It adapts itself to its surroundings and tends to adapt its house to the surroundings. And thus the human body is kept in a state of order in the cold, heat, wet, damp, under all circumstances. Surrounding themselves produce nothing. It is the circumstances. So adaptation is telling that simple substance, it can adapt to any of the environment, whether it be the cold, the heat, or the wet or damp. It adapts to all the changes within its body to the outer surroundings. It adapts, and it is one of the quality of the simple substance. Next, it is that it is constructive. It keeps the body continuously constructed and reconstructed. So here, Kent is telling that the vital force is a constructive one, or having that is having a formative intelligence, and in its absence only there is death and destruction, because that is relating to aphorism 10 of organ of medicine also, where Dr. Hahnemann says that without the vital force there is no self-preservation, like that. So Kent is telling that in that aspect, Kent is telling that the vital force is constructive or a formative one, and it has properties of life substance. It is the highest order of life substance. It has properties and qualities of life substance of a man and an animal, and it reproduces, it moves, it feeds, it is endowed with influx, and lastly, it can be killed also. So when this simple substance is killed, is that when there is death and destruction only, it is killed. Unless and until at that time, from the start, it is continuously flowing in the body, in every part of the body, and it is completely constructive or formative. Then we can analyze it in degrees of simple substance. So what are these degrees stating at? Kent always tells about series in degrees like that. So he tells that the human body has its degrees of life substances existing in degrees suitable for all its use. The innermost degrees of life substance are suitable to the will and understanding, and the outermost cores to the coarse tissues. And there is one continuous series of quality in degrees from the innermost to outermost. So Ken says that from the inner core, it is the will and understanding. And outside, when it comes to the outermost layer of the circle, it will be the coarsest tissues of our body. And in each area, in the inner core up to the outer core, each of the qualities will be in certain degrees. In the inner core, will be too much of what in the inner core it will be what too what highly dynamic, and when coming out to the outer cores, the degrees will be differing. So he is telling it with a simple example of a silicea, that is, silica has its degrees of simple substance within it. The 30th will sufficiently be similar in form to uh, react in a curative way to the sum of the diseases of man, correspondingly superficial and core series of the body, corresponding to the superficial and core series of the body, and it ceases after a time to act in the 30th potency, and it has to be further potentized in order that it may be similar in quality to the inner degree, even until it reaches the very innermost or finer degrees of the simple substance. So, in the inner core, after you are giving the 30 potency, it is not acting. You can go to the highest level, 200, then to the 1 10 like that. So, from the outer to the inner, as well as from the inner to outer, the qualities and the degrees of fineness, they are different. So, each of the simple substance have degrees in different ways, and we have to give the suitable medicines as per such degrees of the simple substance. Then he's telling that it has got aura. So everything in the universe has its aura or atmosphere. This aura you can see in all the entities, and aura becomes useful and it produces a prominent sphere in the study of homeopathics also. So the consciousness between two simple substances is really that the atmosphere by which one knows the other, and by which all affinities and repulsions between simple substances are not. They are in harmony or in antagonism. So you have a different varieties of aura within us, outside us, and it is not only seen in human beings, but it can be seen in anything. And either it will be in harmony or in antagonism. And he says that the simple substance too has its own aura. So we have a vital force within us, and this vital force has been given different names by different authors. So when Hahnemann was telling about vital force in aphorism 9, in the healthy condition of man, like that, he starts it by telling. So he has an idea of what he meant by a vital force. And in the sixth edition, you can see that that vital force, the nomenclature of that vital force has been changed to vital principle. But what he means by this vital principle and vital force, they are one and the same. Likewise, there is a vital energy which H. Robert speaks of, which Poker also tells of. And that vital energy is nothing else other than the vital force itself. And that is the same simple substance which our Dr. Kent is trying to convey to us. So the names are different, the authors have given different names, but they are one and one subject only, that is the vital force expressed in different names. So, as we have gone through observations and simple substance, now we are coming to chronic miasms of Hahnemann. So, it is how, from the start itself, Hahnemann is trying to tell us how he has come to the arrival of discovery of a chronic miasm, and which was the first one he found, then what he found, and how he came to the findings of Psora, because Psora was the last one which he identified. So, while going through the textbook of chronic disease, their peculiar nature and the homeopathic cure by Samuel Hahnemann, we can see that at first Hahnemann conveys to us like a story, like he was in search of this chronic disease. Why he made so? Because there were some observations which he found, and these were the observations what led him to think about something else is there. And what are these observations? Is that the homeopath was successful in the management of acute epidemic and sporadic diseases, and he can see that there is reappearance of seemingly cured elements. So the ailments which was seemingly cured again reappeared. And the remedy which was good at first for the same condition was helpless when it was repeated again after it has reappeared. So there is an acute disease, epidemic, sporadic, or individual disease, and he has given medicine for this, and that has been cured. Then this seemingly cured ailment, which was like that, it again reappeared. And he has again given the medicine. But when repeated, the medicine is of no use. And he is looking then to the correct mode of life. Even with the correct mode of life and the medicine, there is some obstacles that is coming to the recovery. The paucity of symptoms was never of long duration. And what is meant by the paucity of symptoms is that the symptoms that remained concealed after the use of remedy, it did not belong concealed for a long time. Again, it came back. There was delay in progress or improvement of the case. And from starting, the beginning was promising. The continuation, they found that it was less favorable, and at last the outcome was hopeless. So these observations made him to rethink. So he thought about it. So when thinking about this, he got five questions in his mind. When then this less favorable, unfavorable result of the continued treatment of non-venereal chronic disease, even by homeopathy? Then what was the reason of the thousands of the successful, unsuccessful endeavors to heal the other diseases of a chronic nature so that lasting health might result? Might this be caused by too small number of homeopathic remedial means that were provided for the pure action? Why then cannot vital force efficiently affect through homeopathic medicine produce any true and lasting recovery in these chronic maladies? What is there to prevent this? So these questions arise in Hahnemann's mind. Why it happened, whether the number of remedies were small, what was it that was preventing it, and why cannot the vital force give out a long lasting recovery in this chronic malady? And why there were not much of success in all these chronic diseases? And what was the why this unfavorable condition occurred? So there were certain clues coming to this. So he came to the clues that there is always to encounter only some suspected fragment of a more deep-seated original disease. And he must find out as far as possible to the whole extent all the accidents and symptoms belonging to the unknown primitive malady. The miasmatic chronic malady, once advanced and developed to a certain degree, it can never be removed by the strength of a robust constitution. So he got three clues. That is, there was something deep seated, and only a part of it has been seen by us. And we have to dig far to all the accidents and symptoms belonging to that unknown one malady. And once these maladies, chronic maladies, have developed to a certain degree, the robust constitution's vital force won't be able to pull it out from the patient. So now, after finding that, he found that the sole cause for all of these conditions belongs to the Psora. Psora, the fundamental disease of so many chronic maladies, and they never pass away of themselves, but they always increase and are aggravated even till death. So the three chronic miasms which he eventually found was first was syphilis, so-called the venereal chancre disease, then the psychosis or the figure disease, and after these two only he came to the Psora, the chronic disease which is the foundation of the eruption of the itch, which he shall treat of the first important one. So he gives us so much of what names for Sora, like it is the most ancient, most universal, most destructive, most misapprehend, oldest, most contagious, most hydra-headed. So the name hydra-headed, the hydra, it is a female water serpent, and it has got a poisonous fumes and smell, and its blood is also poisonous. So one of the story relating to Hydra is that one of the tasks given to Hercules was to kill this Hydra. As Hydra is a female water serpent, it has got too many heads and all. So if you try to cut one head with a sword, two more will come in its place. So likewise only, what Sora is also. If you try to remove it from one part, uh, in two other parts, it will again show off. Like because of this complexity of Sora, Hahnemann compared it as most Hydra-headed. So the main characteristics of Sora is that voluptuously tickling, itching, unbearably agreeable women, and rubbing and scratching, long continued burning of affected parts, late night and before midnight, the itching is most frequent, most unbearable. And Sora has passed through hundreds of generations of people and has produced innumerable variety of defects, injuries, derangements, and sufferings. So, when going to the history of Sora, you can see that in the chronic diseases, Hahnemann has told that, like Moses has been recorded like 3,400 years ago in the form of Caliphate. Leviticus he has written in the book as malignant itch or garab, and the Alexandrian translators has given the name of Sora agria. Vulgate has that as scabies jugis, Plato as lycopicron, Cicero as dulcet of scabies. Jonathan, he tells his sora as dry it spread over the body, and Occidental sora it appeared in the form of Saint Anthony's fire. Like when you go through history of sora, you have too many names for sora in each era, in each translator's way, in each author's namings. You have got different names of sora. So they can be said as synonyms of Sora in the oldest times. So how Sora came from a from the Saint Anthony's fire or the form of erysipelas, how it came to the normal each form is that the returning crusaders, when they started to have maintain proper hygiene and wearing cotton clothes like that, all the severity of Sora has decreased, and then it came to the normal what form of itch over the skin. That is how we get a presentation of nowadays presentation of Sora as a just a itch over the skin, but it be a voluptuous tickling itching. So Ludwig Christian Junger, apart from Hahnemann, was the person who found that suppression has too much of consequences. So he has given 97 observations. Like in a sanguine person, there will be thysis, piles, or renal colic on suppression. In a choleric person, you have a swelling of inguinal glands or stiff joints or malignant ulcers when you're suppressing a skin eruption. In a fat person, there will be suffocating cachera, mucus consumption, then inflammatory fever, acute pleurisy. And in autopsy, you can see like there are so much of pus-filled cyst, induration of lungs and all. So these are the commonest forms of observations what we have observed, which as the consequences of suppression. Hahnemann too tells that you should not suppress a itch. So these are the apart from Hahnemann, Ludwig Christian Junger is the person who is giving you 97 observations which has been quoted in your chronic disease regarding what it would be like when you do a suppression. So in a phlegmatic, it will be like dropsy, delayed menses, and which when itch is driven during the flow, you will have a monthly hemolysis. And the melancholic will become more insane. The older woman, they may have ulceration of uterus. Nursing woman, there will be milk lacking due to the suppression. So these are some of the suppressions which you can mention or which has been mentioned in the textbooks. So while telling about the Sora as a third miasm which Hahnemann what found out, we should know about the development of the miasm, how it is happening in a person. So first is the time of infection. The moment you get the infection, it may be from a nursing mother, or it may be through the touch of a towel, or it may be from the mother to a newborn. Anywhere and any place, it is the first time of infection. It's the time of infection where you get the first attack of miasm. And the second, it has a phase of internal development, like any other disease having a contagious organ means particle getting inside our body, it have an incubation period and then it manifests out. Likewise, the second stage is the incubation period where it has an internal development. And thirdly is that it manifests in the form of an external disease. So Hahnemann here also mentions it's this chronic disease about the half acute miasms and half spiritual miasms. He tells us half acute miasms and miasms that doesn't have any eruptions. For example, he gives that hydrophobia as example. And in half spiritual miasms, these are other miasms apart from the chronic three miasms. It is a specific fever with specific cutaneous eruptions like cowpox, smallpox that are said to be in half spiritual miasms. So, regarding the antisoric treatment, Hahnemann has given some instructions. So, what are the instructions which Hahnemann has given? So, the best time for taking an antisoric medicine is early in the morning while fasting. And how you should take it? Dry and allow to dissolve on the tongue, or you have to moisten the remedy with 2 to 3 drops of water on a spoon. And within 30 minutes to 1 hour after the medicine, you should not eat or drink anything else. And after taking the medicine, you should not sleep and should be perfectly quiet for an 1 hour. And you should avoid the strain of the mind by reading, writing, computing, or by conversations. And in case of females and pregnancy, has given some other instructions like medicines. It need not be taken before menses nor during the flow. If necessary, you can take medicines just 4 days, that is 96 hours after menses have set in. So I remember like whether it is in a PSC MO exam or a PG exam, this question has been asked. Like how many hours Hahnemann has told that before you can take a remedy. That is 96 hours after menses have set in, or 4 days necessarily. If there is a necessity, you can take. And I think he mentions about Paxomic as the medicine which you can take. You can just go through the chronic diseases for confirmation of this portion. And in case of sucklings, the mother or the wet nurse receives the remedy through through their milk. It acts on the child quickly, mildly, and beneficially. So for the sucklings, the mother or the wet nurse has to receive the remedies. So regarding pregnancy, Hahnemann has told that the antisoric medicine acts more definitely due to the increased sensitiveness of female body, and the doses should be given small. It is a favorable time for treatment. And he tells that footnote of aforementioned 284 of Organon of Medicine also, that sulfur should be given in the first pregnancy and it destroys Psora of both the mother and the fetus. So aforementioned 284 footnote, antisoric treatment during pregnancy. Sulfur should be the medicine that has to be taken and the dose has to be small and it destroys the Psora both for the fetus and the mother. And there are certain rules which Hahnemann tells about antisoric treatment. We have seen some instructions before. And what are the rules is that whenever a medicine is acting, when an antisoric medicine is acting, no other medicine should be given again. And when the troublesome old symptom reappears, there is no need of any other medicine. What does that mean? That the medicine is acting deep into the essence of the disease. And different symptoms which the patient has never before occurred may be peculiar to the remedy. If it is a mild one, we should allow it to pass off without interrupting. And if it is a severe one, we should antidote. Because we can understand that the antisoric medicine was not similar. So Hahnemann is telling that we should understand the effect of the remedy. If a remedy is acting, we should not give any other remedies. And if the old symptoms which was troublesome are coming, we should just have a wait, because if it is not of that much intensity, we can wait and see what is coming next. And if it is a different symptom appearing, picture appearing, if it is a mild one, it will pass off without interrupting, and if severe, we can give an antidote. And aggravation, when it comes on the following days, maybe it will get lessened in the coming days. And that is a sign of cure, because what we experienced was a homeopathic aggravation. And in the aggravation with increased severity or the same strength at the beginning, the dose was too large, antidote it, or another antisoric medicine in the moderate dose has to be given. So that was regarding the presentation, and the whole topic is not yet complete. For today, I have prepared till here only. Hope it would be useful for you people. Thank you.
Thank you, ma'am.